Hey everyone, welcome back to my channel. My name is John and I'm a physical therapist. Today I want to help you make a better and more informed decision whether or not you should be going to a particular physical therapy clinic. I mean, you can't just do a Google or Yelp search in your neighborhood to figure out which physical therapy clinics have the best reviews, but it can be more intricate than that. Can you make the best choice that gives you the most value for your money and time, and one that will give you the best results? Have you ever ate at a subpar restaurant? The server didn't really come around at all and they made you wait, and in the end the food wasn't that great at all. Will you be going back? It's similar for when you go to a physical therapy clinic in terms of your experience as a patient and customer. So I've worked in the physical therapy industry for several years now, and I like to share with you 5 red flags or 5 signs you should not go to a particular physical therapy clinic that runs like this. Then I'll give you some examples of what you should expect, my opinions of what the standard of care should be. So red flag number 1 is going to be bad bedside manner / customer service. So one thing that I as a physical therapist values is customer service. When you go into a physical therapy clinic, it's usually because you've sustained some sort of injury. You're hurting, and you need somebody who will hear you out and figure out for you how to go about rehabbing this injury. You need somebody who is able to work well with you through your problems and be respectful about it. When you step into a clinic, you are a paying customer and you deserve to get good customer service. You shouldn't get a therapist who is rude, who makes comments that blame or shame you in any way for your situation.
Shut up. Shut up.
On the contrary, you should get a therapist who cares, has compassion, and demonstrates active listening by being able to empathize with your situation. The therapist should never shrug off your concerns or your beliefs, even if they disagree with you. They should go about it in a respectful and professional way. Red flag number 2, absence of a thorough evaluation. One important aspect of a physical therapist's job is getting a good idea of who you are, what your body is like, and where your limitations lie. A skilled therapist should be interviewing you a string of questions to determine whether or not your condition is indeed as the doctor prescribed. Oftentimes, patients will go to a doctor who doesn't do any sort of exam. I mean, can you be confident at the dentist's office that you need a root canal if they didn't even look at your teeth or get an image of it? They should get a history of what happened, how your condition behaves. If your back pain only flares up after you lift weights, then they should know about that. So later on down the line, they can ask you the same questions to see if your condition has improved. A movement screen is always important. The physical therapist should be able to know how much mobility you have in the involved region, and they should at least get a brief assessment of your posture. If you're going in for neck pain, the therapist should guide you through looking up, down, turning your head side to side. If you're there for a low back injury, your therapist may tell you to bend over, bend backwards, bend to the side, rotate your spine to get an evaluation of how your spine moves. Red flag number 3, generic treatment with no education about your condition. A skilled therapist should always be able to justify why they are doing a certain treatment. I see this complaint a lot. A patient goes into a physical therapy clinic, gets a short interview, and then walks out with a large list of exercises that nobody demonstrated to them, and you don't even know why you have to do the exercises. You have no idea what just happened, and you're not given proper tools to be empowered to help yourself. You should not be getting a handout of exercises that were poorly explained and not demonstrated to you. Red flag number 4, poorly supervised physical therapy sessions. A quality therapy practice should emphasize patient care. It's possible that your therapist has a lot of patients to see. That's what's required to keep a practice running. Oh my goodness, this dog. That's what's required to keep a practice running. But in no universe should you see your therapist for just 5 minutes, then they move on to someone else. At the very least, your sessions should be supervised or with clear explanation that they may pass you off to a physical therapist assistant or one of the trainers to finish up your exercise routine. As long as you arrive to your session on time, you should expect that the therapist works with you one-on-one, asks you about your condition, and see how they can better help you on that particular day. You should see a progression of your program that your therapist dictated because you're paying for the time of their skilled care, not so they could just bill your insurance. Red flag number 5, lack of outcome tracking or proper assessment. One clear way to know if your treatment is working is to keep track of where you are on the day that you arrived to physical therapy and be able to compare that to all the subsequent sessions. If you go to and pay for a service, you usually expect results. Let's say you hire a professional trainer with the intention of losing weight. You know that you got results when you stepped on the scale and you lost 5, 10, 15 pounds. In my opinion, quality physical therapy is focused on objective results. If you go in with neck pain, you should come out with less neck pain. If you go in for a postural problem, you should come out with better posture. A therapist that is result-oriented should be asking you about a key sign to know whether or not that the treatment is working. For example, you go to the physical therapist for neck pain, and your complaint is you cannot sit in front of your workstation for more than 30 minutes without aggravating your neck pain. The goal would be then for the therapist to figure out how to allow you to perform this daily function with less pain and greater duration. So a sample goal would be, I can now sit in front of the workstation for more than 1 hour with no neck pain. Or your complaint is, I can't bend over to pick up things. Then you should be at the end of your treatment be able to say, I can now bend over and pick up things without aggravating my low back pain.
Bend and snap.
Goals can be a lot more specific based on your condition, but if you attend therapy and have not encountered any sort of way to track your outcome, then I suggest you look elsewhere. I hope that these 5 items are on your checklist to help you be a more informed consumer of physical therapy. There are very good physical therapy clinics out there, and if you've had a bad experience, let me know in the comments below. If you guys are interested, I have more thoughts about what you should expect out of a strong physical therapy practice. I hope that you're all doing well and you get the help you need. Thank you guys so much for staying till the end, and I hope to see you guys in the next one.